Hello and welcome to the HealthQ channel, the health awareness channel where our mission is to motivate you to look at the brighter side of your health. I am your host, physiotherapist Meghnana, and yet I am here with another video on Bell's palsy. So today we are going to talk about a very important problem that people have post Bell's palsy, and that is synkinesis. Now, synkinesis is an after effect of Bell's palsy and it stays with people for a very long time. Many of you have asked how I can manage this problem. In today's video, I'm going to tell you not only how to manage synkinesis, but also how to prevent synkinesis. So without wasting much time, let's get started. So the method that I'm going to talk about, or I'll say a technique which I'm going to talk about in today's video, is called as neuromuscular facial reeducation. This is a physiotherapy as well as occupational therapy based concept that focuses on re-educating the muscles that has kind of lost the memory of how they function. Now, this particular technique not only helps in prevention of synkinesis but also in management of synkinesis. But this is a long process and requires a good association, or I'll say collaboration, with your therapist. So make sure, along with the guidelines which I'm going to share with you in this video, do share this video with your therapist and understand and work in the pattern. So let's see what exactly is neuromuscular facial reeducation. Basically, this particular method stands for the process of facilitating the muscles that are paralyzed following Bell's palsy and the process of inhibiting, or as you can say, reducing the activity of the muscles which kind of are working involuntarily following synkinesis. This particular process is done with the help of patient as well as therapist working in collaboration. The first and the most important thing required here is the knowledge about particular muscles that are involved and how they function. Apart from this, the second thing that is very important, or I'll say crucial in this process, is the requirement of some feedback that is coming externally for the patient. This feedback can be taken with the help of the mirror and even sometimes surface EMG machines. Now, surface EMGs might not be accessible for everyone. Hence, mirror is something that comes handy for every individual. Now, in order to reduce, or I'll say manage this problem of synkinesis, the things that a patient should do is, first step is to understand what all muscles are underactive, which means which all muscles are weak and are not performing to the fullest. The second thing that requires understanding about is which muscles are more hyperactive, or I'll say are moving involuntarily. Hence, here comes the role of your therapist, where he or she needs to make a patient understand which muscles are underactive and needs to be performed well, and which muscles are overactive and which needs to be inhibited. This realization helps the patient to be conscious about all the movements that are being performed. Remember, in neuromuscular facial reeducation technique, the quality of movement is more important over the quantity of movement. The second most important thing which needs to be done in neuromuscular facial reeducation is setting up realistic goals. Once a patient, as I mentioned in my previous video on assessment of recovery of Bell's palsy, once you are able to understand or else recognize which all muscles are weak and which all muscles are hyperactive, you can then set goals as what should be the next achievable goal for your particular group of muscles. Based on that, the set of further exercises can be determined. The third step is start the exercises. Now, the exercises are almost the same which I have shown in my previous video, that is on 21 exercises for Bell's palsy. Make sure you watch this video. The link to that video is mentioned in the description box below. But now, based on your situation, on what stage of Bell's palsy you are you having synkinesis or not? Based on that situation, how you will perform these exercises will vary. So let's see, if you are in an acute phase of Bell's palsy, which means your Bell's palsy is less than 15 days older, then what things you should take care in your mind while performing this 21 exercises. Now, in acute phase, there would be mostly moderate asymmetry of the face that would be visible while performing no movement at all. But when you will try to make some facial expression, this asymmetry would be very evident. The second thing that would be very common in acute phase would be there wouldn't be no contractures present on your facial muscles, which you are very much prone to develop in future. So keeping this in mind, the exercises that you will do, you have to ensure that you perform the movement gently, focusing on the type of the movement, which means, for example, if you are trying to make a pout, you have to ensure that you are doing it correctly, and that's why you need to take the help of your hands. So this type of activity are called as active assisted exercises, where you are trying yourself at the same time taking some assistance of your hand to perform the movement in correct pattern. Something like this. Whenever you are trying to exercise to close the mouth and make a pout, give some assistance with your hand. In this activity, what I did, I give some assistance with my hand, but at the same time, I was also contracting my muscles. My hands were the guiding factors for this muscle to move in the right direction. Similarly, you have to perform all the movements. Like, for example, if you are raising the eyebrows, you have to give some support with your hands and assist the muscle in right direction. Now this is very important, because if you are doing your movements in right pattern from the start, there are very less chances for your muscles, or else say your nerve, to rewire or else say connect in a wrong direction, which will prevent synkinesis in future. Now along with this exercises, in order to maintain good relaxation state for your face, make sure you massage your face very properly before starting the exercises, and at the same time you can also start doing some stretching movements for your facial muscles. Now want to know how to do massage for face at the same time stretching for your face? I have made videos on both of them, and the link to that videos I will put in the description. One more thing that you can add up while doing your facial exercises is add some facial expression to your movements. Now it has been proven in scientific researches that when you add facial expressions that you make while going through emotional phases, then the movement that you tend to do is much more better compared to just conscious facial muscle contraction. Which means if you are trying to do the movements or else exercises for your cheek muscles, where the activity is simple smiling activity, just add that emotion of smile. Just try to smile and do this exercises, or think of some happy movement and then do this exercise. This will add up and help your neuroplasticity or else your nerve to regenerate in a better way. Coming to the next phase, that is your subacute phase, where you are kind of recovering but you are in the highest chances of developing synkinesis. In this phase, your Bell's palsy is less than or else somewhere around 6 months older. During this, the pattern that you might show in your Bell's palsy is there would be a moderate asymmetry that would be seen on your face. There would be little synkinesis that will now start happening, and there would be some difficulty in performing some facial functions like smiling, chewing, blowing air from your mouth. Now again, if you are fortunate enough, you would be absolutely fine in first 3 months and you need not go through all these phases. But few people have to go through these phases, and that's why this video is meant for them. Again, active assisted exercises needs to be continued. Your muscles need to be retrained and shown the right way or else right pattern of performing movement. Since you are in the phase where synkinesis is developing, it is very important to contract your muscles in right way and inhibiting the muscles which are not in the right direction. And that's why the second thing that you need to take care is you properly give feedbacks to your face how you're performing, and that's why it's very important that you perform your exercises in front of mirror. Always make sure while doing this active assisted exercises, again the exercises stays the same in the 21 exercises video which I have made. All these exercises, make sure you are not performing any wrong movements. If you are doing that, you need to inhibit that or stop that. How you will do that? For example, if you are trying to smile and your eyes is getting closed, or else you feel that slight contraction is happening around your eye region, you need to limit the smile expansion. So Just smile to the point where the muscle contraction is not starting. Just stay back and just come back from there itself. Do not overdo a activity. Overdoing of activity will increase the activation of the synkinetic muscles and will lead to development of synkinesis. So again, here you can continue with facial massage, at the same time facial stretching. Now let's move on to stage 3, which is called as the movement control stage, where your facial muscles, especially the normal side of facial muscle, kind of starts taking over the movement from your affected side, which means whatever facial movements are happening, it's done with the help of your normal side over the affected side. Asymmetry of the face would be evident in this stage. There would be tightness, there would be synkinesis, and also there would be some abnormal movement patterns that would be noticed in the day-to-day task, like chewing, smiling, drinking, blowing air, closing eye, etc. In this phase, what you need to do is first take the help of thermotherapy. What do I mean by this? For thermotherapy, which means whenever you are starting doing exercises, apply some ice pack over your affected area. Ice pack will lead to vasoconstriction and sudden vasodilatation of the arteries surrounding your face. This will help the muscle spasm to go down and also will help your muscles to stretch well and exercise well. But whenever you are in rest, opt for hot fermentation, as it will lead to increase in blood flow to the area and also allow your muscles to relax and settle down. The second thing that you should do here is focus more on facial massage. In the upper stages, it was okay to be gentle on your facial massage, but now in the later stages, the focus is required more on massage so that the tightness or stiffness of the muscle is not happening. But along with facial massage, the second thing also is required is facial stretching exercises. The focus on exercises should be equivalent to the focus on stretching and massage. Third thing that you should do here is try to make your facial movements as normal as possible. What do I mean by this? Since in this stage, a person would have developed synkinesis, whenever he or she will try to smile, the eye closure will happen. Now here you need to start with some inhibitory techniques. What do I mean by inhibitory techniques? Which means if you are trying to smile and this eye closure is happening, you need to give some resistance to the facial muscle of your eyes and then try to smile with the help of hand. So what you are doing here is you are preventing the wrong movement, at the same time facilitating the good movement of your face. This helps your muscles to understand and learn the right movement pattern. And also this will help your muscles to relearn how to isolate different muscle contraction. Now let's move on to the fourth and the last stage of Bell's palsy, where the synkinesis is severest. More than 50% of voluntary movement that you will do on your face would be controlled by your unaffected side, which means the unaffected side muscles are dominating your affected side. That's the reason the affected side muscle would be weaker, tighter, and shrinkened up. And here the emphasis on exercises should be more on stretching and massage over the strengthening exercises. The amount of time and repetition of stretching you do should be more, say 2 or 3% more to the normal exercises that you do in order to improve the strength of your muscles. There could be also muscle spasm that would be present, which will lead to some involuntary muscle contraction even while you are at rest or even you are trying to do some voluntary movements. Now this spasm is again a sign that muscle needs to be relaxed. So what you need to do here is, again, the first most important thing is thermotherapy. Take the help of ice pack, at the same time hot fermentation. Ice pack should be done before exercises. Hot fermentation should be done later after exercises, maybe when you are trying to sleep or you are in a relaxed state. Third thing here you need to do is alter your synkinetic movement, which means whenever you are trying to smile, if you feel that the movement is happening on other side, try to smile in a different way, or else smile in a way that looks absolutely normal or near normal. Here you need to reduce the pace of your smile or just try alternate smile movements. For example, instead of smiling completely like this, just smile very less. making sure that the synkinetic movement is not happening. The contraction is very limited as possible, and gradually as the tightness reduces and you are able to improve the strength of your muscles, then you can start retraining your muscles in the normal movement as you were doing in your past. And one more thing that can be done here is a different kind of massage technique, which is called as cross friction massage. This is a kind of more intense massage technique where the tight muscle fibers are moved in horizontal as well as vertical direction in order to break the spasms and adhesions that is being made. In next video, I would be doing a live session where we will sit together and try to do these exercises based on different stages of Bell's palsy. So make sure you join with me on that live session. Make sure you like this video, share it with your friend or someone who needs help related to Bell's palsy, and don't forget to subscribe to our channel. On that note, I will see you in another video. Thank you. Bye-bye.